mode.
Hello everyone and happy Tuesday. My name is Janet Walker and I have the privilege, together with Eric Bruns, who'll be coming on in a minute, of co-directing the National Wraparound Initiative. I'm here in Portland at Portland State University, where the Regional Research Institute houses the National Wraparound Initiative. Before we get started, I do want to recognize the support that we receive from the Technical Assistance Network for Children's Behavioral Health, in which the NWI is a core partner. A couple things to be aware of before we get started. First, if you have any problems with the audio, check the settings in the audio pane that pulls out from the right side of your screen. Second, this is kind of important, everyone is going to be on mute the entire time, so there won't be any actual talking except by the panelists. However, we do encourage you to ask questions whenever they occur to you, and you can use the question function. It's one of the boxes again on that menu that pulls out from the right side of the screen. And if you need to chat to the organizers, you can also chat that way. Finally, the webinar will be recorded, and very soon after the conclusion of the webinar, it will be posted on our website. You see the URL, or you should be able to see the URL on the screen. And if you forget that or need to remember, you can search for NWI Wraparound. You'll get the NWI's website, and then you can just look for the webinars. Next slide, please. Okay, so today's webinar is going to be a discussion of new directions in wraparound accountability and quality assurance. And Eric Bruns, together with several of his staff from the University of Washington branch of the NWI, will be presenting today, together with Jonathan Sutter, who's with the University of Cincinnati and Claremont Fast Track. We're planning on about an hour of presenting, followed by questions. We may break between presenters for questions, so if you have questions, you can submit them at any time. And with that, I am going to turn the webinar over to Eric, who's going to MC the presentations. Eric?
Well, good afternoon probably for most of you, and good morning to those of you in Hawaii or here on the West Coast with us in Seattle and Portland. This is Eric Bruns. I'm an associate professor here at the University of Washington, and indeed, as Janet just said, since about 2003 or 4, we have co-directed something called the National Wraparound Initiative, and are pleased to also reference the National Wraparound Implementation Center, which you see on the home page here, or the title page for our webinar today. You can learn more about NWIC, as we like to call it, or the National Wraparound Implementation Center at nwic.org. This is something that we've launched with our third university partner at the University of Maryland to promote high-quality wraparound practice through training, technical assistance, and accountability support to states and communities across the country. So indeed, today we're going to be talking about something very near and dear to our heart here at the University of Washington and at the National Wraparound Initiative, which is accountability and quality assurance in wraparound. So Janet and I, back in 2003, we convened an initial meeting of a bunch of wraparound experts and practitioners and trainers across the country, family leaders, youth leaders, and launched the National Wraparound Initiative as a way to better define and disseminate information about what high-quality wraparound care coordination consists of. One of the reasons we did this back then was that wraparound had started to really take off across the country, but there was a lot of differences of understanding and opinion about what high-quality wraparound practice actually looked like. And so one of the big reasons that we started the National Wraparound Initiative back then was to promote better quality assurance and accountability. In short, if you don't know what a strategy or a intervention is, it's very hard to measure whether you're doing it well. So since 2005 here at University of Washington, we've kind of been the center of dissemination of accountability, fidelity tools for wraparound implementation. Now there's all sorts of things we could talk about in terms of new directions. We're continually trying to improve and expand the offerings to the field that will help support high-quality wraparound implementation out there. Today we're going to focus on three things. One is a new a revision to the Wraparound Fidelity Index that is a short survey form of the WFI. We're going to talk, as Jonathan Sutter is going to be on, from the evaluation team in Claremont County, Ohio, Fast Track, to talk about some very exciting work they've done developing mobile apps for collecting fidelity data. And then finally, Jennifer Shore-Coldiron from our group here is going to talk about probably the most exciting thing we've worked on, which is something we call the Wraparound Structured Assessment and Review, or WrapSTAR. So with no further ado, I'm going to do a quick little intro to our webinar today. If you could advance to the next slide. Oh, there we are. Okay. So we talked about what is NWIC. So the National Wraparound Implementation Center, just so folks know, we are striving to support states, communities, and organizations to implement wraparound effectively. Animation, we're going to have to kind of figure out how to keep doing this, so go ahead. Yep. So NWIC, we're trying to use cutting-edge strategies to support wraparound implementation that's based in implementation science and provide support that's intensive yet affordable to states and communities, provider organizations. And we focus on three main areas of support: systems level support, workforce development, which is often the first thing people ask for, which is how do we get training, but also evaluation and quality assurance, and hence our real interest in trying to make sure that we are forever innovating and improving the methods that are available to communities and states and so forth to do evaluation and quality assurance. Next slide. So this is really our basic premise, and research in wraparound and in implementation science really supports this. Go ahead and hit the next slide. So we know that positive child and family outcomes is determined by a lot of things, but one of the things that we know that it's determined by is how effective our services are. If you have a research-based practice that you're implementing for children and families, we want it to be implemented with fidelity. Achieving that kind of fidelity or high-quality practice is driven by three main kinds of implementation drivers. Competency of your staff, so are you selecting the right staff, training and coaching them? Next one. Do you have organizational and system supports in place? And one of those things is decision support and data systems that are capable of informing you whether you're actually achieving those positive child and family outcomes and whether you're actually implementing high quality practice. So competency of staff, organization and system drivers, and then finally leadership. If you hit the last advance there. And leadership is critical as well. This is all per implementation science. Next slide. So as has been defined by the National Wraparound Initiative, there are 6 types of program and system supports that are important for wraparound, that right side of the triangle. Community partnership and collaborative action are critical. We know that fiscal policies and the way in which we are actually funding wraparound is critical. Whether or not services are in place that wraparound teams are going to have access to. Whoops, we seem to have bombed out to a new view here. But the last, human resource development is critical in terms of jobs, caseloads, and working conditions, but also training, coaching, and supervision. And then finally, the one we're talking about today, accountability. And all of this description of what's important to implement wraparound well is available on the NWI website in quite a bit of detail in our implementation guide to wraparound. Next slide. So in the implementation guide to wraparound, what you'll see is a definition of a wraparound initiative that is in fact fully supported in the area of accountability. And that's a community or a site that has implemented mechanisms to monitor wraparound fidelity, service quality, and child, family, and system outcomes. When a wraparound initiative is fully supported in the area of accountability, it has these mechanisms in place to assess the quality and level of development of the wraparound effort. So next slide. I think we've seen this one. Maybe I accidentally put it in twice. There we go. So types of outcomes data that are critical to collect. And Jennifer will be talking about ways in which we've built these into the structured review of wraparound practice through WrapSTAR. But meeting needs or goals that have been documented in wraparound plans is a type of outcomes data. Increasing child and family assets, strengths, and reducing needs is another type of outcomes data. Improving caregivers' well-being, increasing family and youth empowerment, and then this last bullet is so often the most critical target of outcomes data collection, making sure that we're keeping our young people at home, in school, and out of trouble as Abram Rosenblatt wrote way back in the mid-90s about wraparound. Now, in terms of what we'll be talking about primarily today, fidelity and quality data, some of the things that we know are important to collect are things such as data on the quality of the wraparound process that's provided, and ways in which that can be done is through live observation, review of plans of care, and certainly getting input directly from youth and families. Other things that you can monitor include the types of services and supports that are included in wraparound plans. Were the services and supports identified in wraparound plans actually received? Did they actually line up with the needs of the family? And then finally, fidelity and quality data can consist of, go to the next bullet there, satisfaction and buy-in among stakeholder groups. And then I think there might be one last bullet here. What are the barriers that are preventing wraparound teams from doing their work? Okay, next slide. So I want to make sure we get to the good stuff here. Why don't we flip through our accountability milestones really quickly and just kind of make the point that fidelity and quality measurement has been a focus of folks in the wraparound world since at least the late 1990s with the Wraparound Observation Form. The Wraparound Fidelity Index has been around since the early 2000s. Other folks like Lucille Eber and Pat Miles have developed their own mechanisms to try to measure and use data on quality and fidelity. And there's really been quite an explosion of effort in the last 5 or 6 years. Our team here at the University of Washington has developed a team observation measure, which is now in its first revision, so version 2, document review measure. Janet and her team really pioneered the measurement of whether or not communities and states are supporting wraparound implementation with measures like the Community Supports for Wraparound Inventory, or CSWI. And then finally, we've really started to take a look at implementation more broadly and ways to measure whether it's going as we hope by measuring the impact of training and technical assistance, trying to develop a more streamlined version of the Wraparound Fidelity Index, which we will be talking about today. And then finally, the National Wraparound Implementation Center, one of the big innovations of the work that the Institute for Innovation and Implementation at the University of Maryland, our training and coaching partner, one of their big innovations has been the creation of wraparound performance implementation tools, or WFAS, such as coaching measures and so forth. And you can see more about that by going again to nwic.org. All right, so let's get to the meat of our presentation today. Why are we developing new fidelity tools after all those years of previous folks having done so? So go ahead and click down. Again, we have had this kind of core set of implementation and fidelity tools, team observation, family interviews, surveys of community supports, document review measures. Go ahead and click down one more time. And then, of course, now we have added things like the impact of training and technical assistance and the coaching measure, which is called the COMET. Next slide. The reason that we are continuing to innovate and trying to continue to improve is that we see a lot of room for improvement. Some of our tools over the years have been shown to have psychometrics that could be improved. Some of them, as communities and states have learned how to do wraparound better and better, we see that ceiling effects happen. So scores on the Wraparound Fidelity Index, for example, started to approach 85–90% of total possible. So how can we improve the psychometrics, the reliability and validity of these tools, make sure that items are included that really are getting at the heart of wraparound implementation and are actually correlated with positive outcomes for families? A second big thing that we'll go into as we talk about, go ahead and go back. Yep, back to the previous one. So the second big thing we're trying to always do is improve ease of use. So talking about the short form of the WFI is one of those efforts, as well as the work by Jonathan and his colleagues to try to develop mobile apps. To improve data collection response rates, which again is a big purpose of the mobile applications that Jonathan will talk about. And then finally, how do we make sure that the information will be as likely as possible to be used to promote positive implementation and outcomes. And Jennifer, as our third speaker today, will be talking quite a bit about the way we've tried to achieve that by rolling very thoughtful subset of items from all of our different types of fidelity measures into a structured and comprehensive review of practice and implementation. One last slide, and then we'll get to the first specific topic. All of those previous points really roll up into the point that we want to make sure that the data that's collected is used. If folks are just collecting these data because they're mandated to, or because they think that it's important to do so, but without using the information, then there's really not a whole lot of point to it. So one of our points, as I was making before, was that we're trying to make these tools as likely to produce useful information as possible. And what are some of those uses? For example, if you're beginning an initiative to improve or launch a wraparound initiative, you can use the data as an initial formative assessment. So you can determine what your current practices are and what your needs are prior to launching or rebooting some sort of wraparound implementation effort. So kind of a baseline assessment of where you're at. Then as you get going, you can self-assess and monitor your progress. How well have you built those implementation supports to wraparound? How well is it getting you to fidelity and quality of practice? And of course, what kind of outcomes are you getting? Monitoring progress in those areas is really critical so you can build action plans to focus your improvement efforts and your mid-course corrections. A third use of fidelity and implementation is to perhaps do like an annual self-assessment. More and more states that are taking wraparound to scale nationally are asking their sites to participate in some kind of annual self-assessment to facilitate sustained implementation. And then finally, there are in fact more and more places that are using fidelity and implementation tools to recognize sites or communities or provider agencies within a multi-provider effort to determine what level of recognition sites should get for their quality and fidelity implementation. It really is just a reality in our field that accountability sometimes comes with mandates for measurement and some sort of benefit or recognition for achieving high standards of implementation. So that is another use of these data. Next slide. So we're going to go ahead and launch a poll with all of that introduction having been provided and ask, so in your site or the initiative you're most familiar with, how often are the following kinds of data that are so critical collected, including outcomes, fidelity, implementation, and system support for wraparound? So our first question is, how often does your site collect data regarding these different kinds of important areas of implementation? Please go ahead and select one. We're just kind of interested in who's on the webinar and whether or not this is kind of a routine aspect of your implementation, if it's occasional, if it doesn't get done, or if you don't know. So go ahead and click your option and we'll keep moving here. So I can't see what the results of the poll is. Janet or Emily, are we getting some data there? Oh, here we go. So I would say that in the last, over the last, almost 10 years that we've been doing this, this would be something that really represents great progress in our field. I would say that when we first started doing this work, the whole reason we started the NWI is probably a lot of folks would say this was never or occasionally. In 2014, apparently, almost 2/3 of wraparound initiatives are routinely collecting data on these things, which is really critically important. So that's good information to have. It would be good to have done this. It could be an annual survey that we do, Janet. All right, so let's talk about our first topic, and I'm going to try and do it quickly so we can get to Jonathan and Jennifer. Really want to make sure we get to Jennifer for the last 15 minutes of our hour at the very least, because I think that WrapSTAR is a real huge innovation that the field should know about. But one of the components of the Wraparound Structured Assessment and Review that Jennifer will be talking about is a new version of the Wraparound Fidelity Index. So we've been using the WFI for at least 12 or 13 years now, and had gotten to version 4. It was an interview-based approach to collecting fidelity data from families, practitioners, youth, and team members. So we've now created, a lot of you probably know about the WFI EZ, as we like to call it, but the short version is something we call the WFI EZ, and it is a brief self-report version. So it is intended to be shorter. It's intended to be something that you can fill out on a piece of paper or a web survey. And there are versions of the WFI EZ available for facilitators, caregivers, youth, and team members. So just for the next 5 or 6 minutes, just kind of give the field a little bit of an update on this tool. Make sure you know how you can get access to it if you are interested. So again, it was intended to create a reliable and valid measure of adherence to wraparound practice and principles that is easier to administer than the full WFI 4 interview protocol. Next bullet. And so again, it can be completed on paper or online. And it also contains questions about satisfaction and outcomes, because one of the things we've been worried about is that people really did kind of swallow this idea of measuring wraparound fidelity whole, but sometimes outcomes and satisfaction went by the wayside in that transition. Another thing about the WFI EZ is that we made sure, unlike the WFI interview, that the items for the 4 different respondents are parallel to one another, which makes it easier to interpret the results that you get. Next slide. So there's 5 sections of the WFI EZ. There's basic information and demographics of the youth, how long they've been enrolled, and some basic information about wraparound implementation. Then the bulk of the survey is about the experience of that respondent with this young person and their family's wraparound efforts. And this is 25 items on a scale from -2, strongly disagree, through -1, 0, 1, and then all the way up to 2, which is strongly agree. And that's the bulk of the survey. It's about the fidelity to practice that was achieved for that family. But we also include 4 questions on satisfaction, 4 questions on youth functioning and system outcomes, such as placement out of home, school attendance and success, and then finally 5 items on the impact of the child's behavioral health needs on the family. Next slide. So we've gotten over 1,000 WFI EZs at this point, and what we're trying to do is standardize the scoring process to help facilitate the interpretation of these scores. So over the next few minutes, I'll just quickly show you some of the things we've found about the WFI EZ. Next slide. Go ahead to the next one. So this is what the form looks like. This is the cover page. It asks about the demographics of the young person, where they're living, who has legal custody, and so forth. And it asks 3 real basic questions about the child's wraparound effort that we think are absolutely fundamental to even conceiving of what the child and family are participating in is wraparound. Do you have a team? Do you have a plan? And does your team meet regularly? Go to the next slide. And so your online experience as a respondent looks a lot like this. Items, so this is in the fidelity section of the survey. Items such as, my family had a major role in choosing the people on our team, or at the beginning of the wraparound process, my family described our vision of a better future. The respondent clicks on the option that best corresponds with their experience, from strongly agree to strongly disagree or don't know. Next slide. So what we found so far from our over 1,000 forms from across, I think, 10 or 12 sites nationally, is that first of all, we see that the ceiling effect that was being found for the WFI is a little bit mitigated, which is great. We have average scores around 70, 71, 74% of total possible. And you also see that the scores across the different kinds of respondents are much closer to one another, which suggests that it may have a little bit better cross-informant reliability. So we're pleased by that. Next slide. If you want to go back and look at these slides, you can see the characteristics of the respondents in the total pool, but I won't go into that right now. But you can see we got data across a lot of different sites, really diverse sample racially and with respect to the caregiver relationship to the youth in legal custody. Next slide. And what we're finding out there in practice as we continue to compile data, all the data is entered into an online system called WrapTrack that allows us to be able to make sense of the data nationally as well as give local sites access to reports on their data, which is really cool on a number of levels. So what we're seeing is that practice out there is looking like this. In wraparound initiatives where families are getting the WFI EZ, 91% are saying that they have a team that's more than just themselves and one professional. So, you know, that is an interesting finding that there are 9% of families out there in wraparound initiatives that say that they don't feel like they're part of a team. 92.6% say their team meets regularly. So this is what we would expect is very high level of endorsement of these basic fundamental wraparound questions. Go to the next slide. What we're also finding is that site level averages are ranging from between about 68 to 78% in terms of caregivers' responses to the fidelity items, the 25 fidelity items, with an average, as you saw earlier, of about 74% of total possible fidelity. So I was hoping that we might see a little bit greater diversity across sites in terms of their scores so that it would be more likely that the data would kind of represent variation in practice. But it could very well be that as we were seeing for the WFI interviews, that wraparound practice as expressed by sites that actually are interested in collecting their own fidelity data is probably fairly good and fairly consistent in our field at this point. Go to the next slide. In terms of facilitators, we see, again, another spread of about 68% to 77%, with a total, an average for facilitators, a little lower than caregivers at about 72.5%. Next slide. And the data break down into 5 key elements that range from down around 67% on average for effective teamwork up to approximately 80-82% depending on the respondent for strengths and family-driven teamwork. The other 3 key elements that are measured by the WFI EZ include natural and community supports, being needs-based, and being outcomes-based. And these 5 key elements for the WFI EZ are based on both analysis of data as well as alignment with the practice model that the National Wraparound Implementation Center is supporting in its training and coaching nationally. These are 5 versions of the kind of 5 essential elements of wraparound that we are training on. Go ahead to the next slide. Go ahead and skip this because I want to finish up and get to Jonathan. One thing that is interesting is to see what items on the scale of -2 to 2 are most commonly endorsed and least commonly endorsed or least highly endorsed. So we see that certain of the items, like the family describing their vision of a better future, was actually the highest rated item, which was surprising to me. Other high rated items is that the wraparound team reviews progress at the beginning of team meetings, that the family chose a small number of the highest priority needs to focus on. Go to the next slide. The lowest rated items are the following. Members of the wraparound team sometimes do not do the tasks they are assigned, which may seem kind of obvious that that sometimes is going to happen, but the fact of the matter is that high quality wraparound practice means that somebody is making sure that those tasks get done. And the very lowest items were families, caregivers in particular, are worrying that the wraparound process will end before needs have been met, and people being on the wraparound team that are actually not involved in their services. All right, next item, or next slide. Let's go ahead and keep going. I want to transition now to a discussion of how these data can be collected efficiently and handed over to Jonathan. The last couple points I'll make about the data we've collected is that we really do see from our pilot tests of the WFI EZ that it appears to be quite user-friendly. We get really high response rates. Jonathan will talk now about how to get it even higher. Seems to only take about 5 to 10 minutes. We seem to be getting better inter-rater reliability and less ceiling effect. And the biggest thing is that it really does provide an option for sites to get a quick take on fidelity, satisfaction, and outcomes from caregivers, youth, and facilitators, and thus promote your internal quality assurance procedures. So with that, I'm going to transition now to Jonathan. Took a little bit longer than I hoped, which is typical around here. As you heard, Jonathan is a leader of the evaluation team at the Claremont County, Ohio Fast Track Initiative. And what Jonathan's going to talk about now is a way to use tablet technology and software to increase response rates on quality assurance tools like the WFI short form. Take it away, Jonathan.
Well, and this is Janet. I just want to barge in for a second. I know we said we might take some questions in between. We are a little behind. We have only a few questions, so I think we'll just hold those to the end, and we will be answering those at the conclusion. All right. Sorry.
Okay. Thanks.
All right. Thank you, Eric. With the on the screen there, let's see here. I hate to say, Janet, I just lost my screen there.
So let's take back over the, should we take the control back to us then?
Oh, did you, I was going to say, did you send the control to me? I'm sorry, I hate to be talking on top there. I do not have a screen.
I think you might want to keep control there in Portland.
I'm not entirely sure what's happened here. Let's see. Okay, I'm going to... Oh, what happened? Oh, okay, I took it back. Okay, we should be getting it back now, so just a sec. Sorry.
Okay.
We had a key member of our staff ill today, and that has created a little scrambling on our end as far as making the webinar go. But we should be fine in just a second.
Got it. All right.
Yay.
Very good. All right. One thing that Eric was saying was with the WFI EZ, and you can advance to the next slide there. Next is basically we were given the option to go with a WFI EZ. Now with that, when we heard that it would be less burdensome and less time consuming, those jumped out at us, just like on your screen there. They really exploded and said, that is what we want to do. So we went with that and we pursued that with next we're going to go to look at what that tool would actually do. And we wanted to actually empirically examine the role that tablet technology had, because I brought up this question about new technology and everyone looked at me like, oh, you are crazy. New technology's not the way to go. So what we did, go ahead and hit next, is we looked at the fact that tablet technology has really gained prominence. Now, I'm not sure how many of you out there have used tablets, but it is becoming more and more popular all of the time. So with that, it became very, very interesting to use that. Now, when we went into the tablet technology as far as being an option, we did have a couple of concerns. Number one, the adoption rates are high, but the data security was a concern. So with our participants, we came up with 3 primary barriers of how the WFI EZ using tablet technology might create concerns. Tablet adoption and ease of use was the biggest one, and like I say, with the example that data security was a concern, tablet device management resources, basically they wanted to know who's going to be running these tablets. Would it be myself at the Claremont County Mental Health and Recovery Board, or would it be an intern that might be available? And third was a concern of Wi-Fi access in the field. Now, in the particular area that I am in, we're in a suburban area, but we do have rural areas as well. And the Wi-Fi would become a problem with that. All right, so next we looked at the facilitators of what would transpire to a successful implementation of the WFI EZ and the tablet use. Comprehensive training came number one, which pretty much goes anytime you have new training, you have a learning curve built in. Reminder sent came out as a concern, and it surprised us. However, it has been very beneficial, which you'll see in future slides here. And operational sessions with the facilitators, that was actually sitting down with the facilitators, teaching them how to use the tablets and how to use them with the families. And fourth was the options for using the tablet surveys for offline field access. Again, this represented the concern regarding the Wi-Fi access. Now let's talk about those facilitators. With the first one was comprehensive training. And basically, we had comments from our team members that said, we just don't know what to click on with these tablets. So we actually built up a training mechanism, which we gave them instructions, which actually showed the team members how to, number one, the information they were sent, and how to click on their link, their URL, which is listed right there on the screen, and the proper passcode. And this was able to give them then the information they needed to be able to use this. Our team members primarily do work with the online form, so they were not as involved with the tablets, but this was very important for them to be able to learn about those trainings. So with the next we got a comment from an administrator saying, you know, with all of this new technology, with all of these new devices, we need to send out weekly reminders. This became very beneficial. First thing we did is we put together a weekly reminder which got sent to the administrators, facilitators, team members, and staff, giving them an overview of what was coming up, what facilitator surveys need to be done for the WFI EZ, what caregiver surveys need attention, and they're all located on the tablets, as you can see on the screen there, and the team member and use surveys as well, which ones needed attention and which ones then got a response. Okay, so on our next slide, we actually sent out then a reminder each week, basically, just giving a real quick recap. It was every Monday morning we sent these out, and it basically said, here's the recap of what you have, with the link for the online version, as well as which caregiver and use surveys are due as well. And that has become very, very, very good as far as reminders go. All right. In the next example, the concern about our offline field access came up, and we gathered a systematic feedback from our players, and they basically said, we need an interactive PDF format for the tablet. Now, the reason we went with that format is because it is open source technology, so for the agencies out there that don't want to invest in expensive data and all, it became very, very cost effective to be able to do this. So using the tablets, and you can see pictures of the tablets right here on your screen, for the offline field access, we gave them, again, instructions on how to bring up. It's a web device called SugarSync that we use here locally, and it basically shows what is synced, what documents, and what facilitator folders are out there for the surveys that they need to complete. And I tell you, it was very beneficial to have this easy to be able to click on and to go to for the next screen. For an example, what we came up with for our tablets at first was our WFI EZ, which Eric showed as an example earlier. This was just too cumbersome for a tablet. It was just too busy, too much data to show on one screen, so we created a format displaying just one question per screen. And we can show you a representative of that, where now the tablet just comes up with one question per screen. Very easy for the users to be able to complete. They simply slide across the page on a tablet. It's very touch sensitive. You just simply slide to the next screen with all the touch controls, and it made it very easy and not cumbersome in order to fill out this particular form. So it was very helpful. We did get a comment from a facilitator, basically said they found the tablets difficult to understand and hard to control. That was remedied almost immediately after we went to the one question per screen. So then we got a question from a research project director, who was April, and she basically was concerned about having to upload these type of files into WrapTrack. We have now, they have now, at University of Washington, remedied that where we can now upload that information directly. So it has become very, very helpful. With all of this, one of the biggest concerns that we have had is on our response rates. And with our response rates, we're all concerned about response rates. Let me show you, this is our first screen. This is what occurred with our WFI 4 and our time frame from August of 2010 to May of 2013. Now, our goal back in those days was only 35% because the interviews were so time-consuming. Here is what it looks like with our WFI EZs put into place. It was an incredible increase in response rates. Currently, and these are as of last Friday, currently our response rate for our facilitators is 100%. 108 out of 108 responded 100%. Caregiver, team member, and youth, you can see as well. The response rates have grown just astronomically. It has been great. So that has been a real plus. All right. We'll definitely get you on here. One thing I want to definitely say is tablet computers, in order to collect data, especially with the WFI EZ, is feasible and effective. It has been proven here in Claremont County, and it is doing great. Our study that we have been working with our organization and with our group has really shown that they have chosen to implement this technology with our own systems, and with the number of factors, the questions have at the moment been easily answered. So it's been a real positive. Okay. Next on that, future research, of course, and you can see Eric had given some of the future responses and the future analytical research that's been done. We're going to be continuing this down the line to see how effective the tablet technology is for future research for our better response rates, as well as collecting data easier and much less obtrusively for our users. Okay. With that, again, we're waiting for questions at the end, so you can skip these next two. This is just information on everybody that was involved in our study.
Thank you very much, Jonathan.
Sure thing.
So, Janet, we are just a little tiny bit behind. Any urgent questions we want to throw out there before we hand it over to Jennifer to talk about a way in which we here at the NWI and the National Wraparound Implementation Center are trying to roll up all of these accountability tools into a comprehensive process?
Well, I actually think that because these topics are so tightly integrated that it might actually be most efficient to hold the questions till the end. We have quite a few now, but we will have time given that we're just about on schedule. So I think we should just plow ahead.
Okay, we'll do that. Hope folks can hang with us until the end. So with that, I'll introduce Jennifer Schur-Coldiron. She's been with us here at the University of Washington Wraparound Evaluation and Research Team for about a year, a little bit short of a year, and it's been a true pleasure to have her on board. One of the many things that she has innovated in her time here as a research scientist is the creation of something called WrapSTAR, and I'll hand it over to her to describe it.
Thanks so much, everyone, for joining us today. Today I wanted to share with you WrapSTAR, which we think is a pretty new and exciting way of looking at how wraparound provider is working. It's very thorough. Today I wanted to go over why we developed WrapSTAR, what it is and what it gives sites, what types of information it gives sites, what staff are required to do, and our next steps in development, because we have just finished some pilots and are starting to do it in a more wider and bigger scale. So first of all, the field of wraparound has been asking and seems to need a more comprehensive program assessment tool. We've had many sites apparently throughout the past decade or so feel like they just don't have time or the expertise to design and implement a comprehensive fidelity and outcomes evaluation plan. They might be using the WFI EZ or the TOM, but a lot of them have come to us and asked, what next? How do we get more information? How do we figure out what to actually do with this information? So some sites are struggling with how to make sense of the data, and some of that really hinges on the fact that they realize that there are a lot of different implementation and system support factors that are underlying maybe some gaps in fidelity and outcomes, but they just don't really know what to do next. And some of those things are hard to assess from the inside. It's hard to really peel back the layers and see how the organization is working when you're actually inside the organization. So we've had some sites come to us and ask for more external ways of looking at these things as well. And we also have had a couple people and different organizations within the wraparound field start talking about the possibility of the need for a certification process similar to what other EBPs have. So that was sort of the impetus for why I started on this journey of creating the Wraparound Structured Assessment and Review, which we fondly now call WrapSTAR. And WrapSTAR is a systematic process for collecting and synthesizing a lot of information. What it does is create a comprehensive snapshot of how wraparound is working within a community and agency. It gives information on a lot of different aspects of and integrated aspects of how wraparound is working. I think some of the highlights of the WrapSTAR is the fact that it's external and objective, so that can give a lot of different stakeholders confidence in what is being said. It gives organizations real concrete suggestions about how they might improve. It's very data-driven. You'll see on some of the next slides that it pulls together a very large amount of information in a very standardized and efficient way. And again, really our goal was just to improve quality improvement and sustainability efforts. We firmly believe that if we can help organizations look at their performance and understand how it's impacting outcomes, that they'll be able to improve and also argue for continuing funding and really have more sustainable initiatives. Next slide, please. So Wraparound is, or WrapSTAR is organized around 4 domains: fidelity, outcomes, implementation, and system support. That underlying those 4 domains are 40 different indicators of quality practice. So there's a lot of different aspects. Like there are 6 different indicators of quality outcomes, 8 different indicators of quality or high quality fidelity. So there's a lot of different pieces that are coming together here. But everything is organized, the feedback and the reports, all of the analysis is organized around these 4 different domains. If you advance to the next slide, you can see how these integrate together to create our framework. And in the very center here, you can see the triangle that Eric has already referenced from the National Implementation Research Network. This is NWIC's Implementation Supports and Drivers framework, and we really use that as the heart of WrapSTAR because it's very comprehensive and it is data-driven and evidence-based. NWIC has put together a lot of different aspects of what it takes for an organization to adopt and sustain high-quality, high-fidelity human services programs. And so we really use this triangle, competency, organization drivers, and leadership drivers. We look into how the organization is doing in all of those different areas to provide feedback and also to help the organization understand how those aspects might be impacting their fidelity and how it might be impacting their outcomes. We also laid on top of what's at the heart of the organization, which is the National Implementation Research, their framework. We laid on top of that the community and systems conditions that Janet's team in Portland has outlined to understand again how the organization is situated within their context. So all of these different pieces come together and show you what actually WrapSTAR is trying to pull together in a systematic way. So the organization gets information and feedback about all of these different aspects of program functioning. And so, the point is that it really enables robust quality improvement efforts because everything is aligned, all of the different relevant elements of organizational performance are being addressed so that hopefully if the organization decides to improve training, then they're also thinking about, well, do we have the data and the decision support systems that we need to actually sustain that training. So everything should be aligned and integrated. The next slide, please. So the Wraparound Wraparound Structured Assessment and Review it relies heavily on the WFAS tools, which Eric has already gone over a bit. We use the WFI EZ, which Eric went over. We also use a revised version of the TOM, which we are actively piloting, and a revised version of the document review measure. So we leverage these existing standardized instruments to pull together and align the feedback. So all of the information coming in the fidelity and the outcomes domains utilizes all of the different questions from these different tools, but provides it in a very streamlined and comprehensive way so that everything is coherent and tells a coherent story of fidelity and outcomes and system support. So most of the WrapSTAR process is moving the organizations through efficiently and systematically collecting this type of information on a representative sample of their clients and their facilitators. Next slide, please. So in addition to the WFAS tools, we also created several WrapSTAR specific measures, and these are mainly to assess the implementation factors that are highlighted in the National Implementation Research Network's framework. So this gets into things like organizational functioning. We use a standardized tool out of Texas Christian University. We also do a site visit where we interview staff and ask them about how are things going in terms of leadership, in terms of facilitated administration? Do they feel like the policies and procedures of the organization are aligned? So we really try to dig into what's going on in the organization and the fact that it's external, that we as reviewers or other people that we're training go into organizations and are a neutral third party. We have found that people really talk to us and share some really good information that sites might not be able to get internally. So that's another really big strength of WrapSTAR. We also, if an organization is already collecting existing youth and family outcomes data, we do have a way of integrating that into our protocol so that we can help the organization leverage that information as well. So if you go to the next slide, this is a Gantt chart of how WrapSTAR is broken broken down. It's broken down into 5 different phases over 4 months. That might seem like a long time, but really the bulk of the process is in the Wraparound Fidelity Assessment System, the WFAS tool administration. We found that we really need at least a month and a half to 2 months to get the response rates and to have enough team meetings transpire so that we can have recordings that we can use the team observation measure on. And that part, the third phase, the WFAS tool administration phase, is very low impact on the staff itself. So if you can go to the next slide. You can see here staff are really vital to the process, but burden is kept as low as possible. So in the preliminary data collection phase, that's really where the bulk of what we're asking staff to do, where those activities occur. So that's really only happening in about the first couple of weeks of the WrapSTAR process. We ask staff to attend a meeting so that they can become familiar with the process, understand why their organization is going through a WrapSTAR process. They also complete a caseload survey. That's probably the most time-consuming thing that facilitators do, and it only takes 1 to 2 hours. They, give information, de-identified information about their youth, about who's on the team and whatnot. They complete a brief survey about organizational functioning, again, about leadership and things like that. And other than that, we really just ask staff, and by staff I mean mainly the facilitators, we ask them to prepare families for what's going to take place, ask them if it's okay if one of their team meetings in the next couple of months is going to be recorded, and help communicate that to families. And other than that, basically staff just go about their daily business for the WFAS administration process. Another key part of the process is having supervisors and administrators on board. We ask that we have at least 1 point person. They're usually administrator or supervisor, and they help coordinate everything and make sure that the team meetings are happening, that the response rates are adequate, and we usually interview those people as well. So this breaks down the staff positions and their expectations during WrapSTAR. And again, the facilitators really only spend about 3 to 5 hours on the entire process, and that's over the course of about 4 months. So we try to keep it very low burden, and what the organization gets out of it is really extraordinary. They receive sub-reports on all of the different measures that were being done, so you'll get a full report of the WFI EZ, a full report from the TOM, as well as a very comprehensive final report that highlights the strengths of the organization in each of the 4 domain areas, as well as gives very concrete suggestions about what might be able to be improved. And all of those are evidence-based. We really try to go back to the literature and our understanding of implementation, strong leadership skills, and all of that sort of stuff to give concrete examples and suggestions about how an organization can improve. And then we also, at the end, facilitate a discussion with staff. So we like to have a staff meeting where everybody that's been involved in the process is present. We will present back the results of what we found, and also jumpstart a conversation with staff about things that they want to do to improve. So really hand back the responsibility to staff to come up with concrete solutions to some of the areas that we found need improvement. And we found that staff are really energized because we, through the process, have been able to uncover some things that they might have been feeling, but we come back and say, here's the data and here's what's really going on. And staff have been very eager to engage in a process of quality improvement, and it's been fairly successful. If you can go to the last slide. So we have finished revising the tools and the protocol based on pilot testing. So through a pilot test, we were able to identify certain questions that didn't quite work, or certain indicators that maybe would go better with a different domain. We really tried to tighten up the protocol and tighten up the tools to make sure that everything was as aligned as possible. We right now are in the process of rolling out a large statewide process. So we're going to be doing 6 WrapSTARs simultaneously, and are hoping to give a state feedback about, in general, how are things going throughout an entire expansion initiative. We also are working with at least one, perhaps two different centers of excellences in different states to build their capacity to independently conduct WrapSTARs with local providers. So instead of our team here at the Wraparound Evaluation and Research team always being the WrapSTAR reviewers, our goal is to build the capacity of sites throughout the country who can be still an external and neutral party, but who can be more local, more involved in what's happening on the ground, and that they can take over the reins and become WrapSTAR reviewers as well. And we also are in the process of assessing WrapSTAR's appropriateness for use as a certification tool. So that's one of our poll questions actually, and we are talking to a lot of different people in the field about whether or not this is a step that Wraparound, as a field, as a model, wants to take, if WrapSTAR is an appropriate tool for doing that, and how it might work to get initial certification and ongoing certification. So that was a lot of information very quickly. I tried to keep it to 15 minutes. Hopefully that gives you just a sense of what we're trying to do with WrapSTAR, and we're really excited about using it in lots of other contexts and seeing how it works and making sure that it's useful and doable for sites.
Thanks so much, Jennifer. And let's definitely launch those last two poll questions, because I think they'll be very informative for us as a team, as well as interesting for the webinar attendees to be able to share their opinions around this. This is one of the things we're very committed to at the National Wraparound Initiative, is basing what we do on the needs as expressed by the community of practice out there. So our question, one of two, is, do you feel like the wraparound field needs some sort of external certification process or review process similar to multisystemic therapy or other EBPs that have relatively more centralized kind of management of implementation? So it's a real straightforward yes, no, or you just don't know, or you're not sure. Should be interesting to see the results of that. Okay, so what do we got for results? I have to admit I'm not 100% sure I know if I know the answer to that. My own feelings are complex. So interestingly, yeah, right? So 2/3 of folks say that they think that would be a useful thing to have available. 15% of folks are being honest and saying that they also have mixed opinions or feelings. So this is very instructive. This is very useful and helpful. So that kind of leads to the next poll question, which I think we should also launch, which is essentially, given this very quick whirlwind review of WrapSTAR as a possible approach to getting a comprehensive picture put together of implementation, fidelity, outcomes, and system support, do you think that WrapSTAR would be something that would be useful for your community or site? And let's bring that poll up. I do believe that's the last poll.
Yep, that's it.
I think we're waiting for the technology here to catch up. Janet, are there any questions you want to throw out there while we're getting the last poll loaded up there?
Sure. I think, it's interesting, I had a question with that certification, and one of these questions seems to reflect that, credentialing. I think people, when you say credentialing, they don't necessarily, automatically think that would be credentialing, I think, at a sort of an agency or organizational level like you're talking about versus credentialing individual providers. So I guess I would be cautious in interpreting that poll result. Because there was a question around that.
Right.
So I think, there's a couple of, I think, sort of low-hanging fruit questions. Several people asked about how to get the WFI EZ and perhaps the new TOM as well. So can you give that information?
Sure. April, I believe, is able to chime in. April is our program director for the Fidelity tools. April, are you able to talk there?
Yeah, but I missed Janet's question. Can you repeat that?
Just
how do they
folks,
get the WFI EZ or the TOM?
Oh, all you have to do is log into our C4C website, which is located here at the UW, and it is c4c.uwc4c.com.
Right, or you could go to rapinfo.org,
Yes.
and there will be a link to a web page that explains the process of licensing for use of the tools. So again, a real easier URL to remember probably is www.rapinfo.org.
And we also have revised the TOM and have a TOM 2.0 that we will be looking for pilot sites to, external pilot sites to start in January. So if you're interested in that, you could also email our Wraparound Evaluation and Research team from our website.
okay. It looks like we have our other poll up here now.
Mm-hmm.
So if people...
So we're always trying to take the temperature of the field. That first poll was definitely one of those kind of temperature taking, although as Janet's pointed out, it could be interpreted different ways. Second one maybe is a little more straightforward. Do you think your site or whatever wraparound initiative you are most directly connected to would benefit from something like the WrapSTAR process that Jennifer described? So just kind of trying to figure out if we are on the right track here in trying to roll up these tools into something that's comprehensive and externally conducted. So let us know if you think that that's a yes, a no, or again, not sure or don't know.
So maybe while people are answering that, perhaps we should get to another question. Several people are interested in knowing at what time points the WFI EZ is done, like where in the process, and is that the same for the tablet version or the paper version?
It's interesting. So I'll let Jonathan chime in a sec about what they do in Claremont, because they're real leaders in this, obviously. What we generally recommend is that you at the very least make sure that you are not administering the WFI EZ before the family's wraparound effort has gotten to about the 3-month mark. So our suggestion is generally to administer the WFI EZ sometime after the 3 months of enrollment in wraparound. That having been said, there's really no explicit expectations about at what point you use the WFI EZ. A lot of sites have successfully just done point-in-time surveys of all of their wraparound enrolled families and the facilitators that work with them at some point in time. Like I was saying at the beginning, an annual review might have each family just doing the WFI EZ once sometime between 3 and 9 months, for example, of enrollment, so that folks have enough experience in wraparound to be able to answer the questions, but they haven't been in so long that they're perhaps on the tail end of transition and can't remember what the beginning of the process was like. So that's a general guidance that you can find in the manual that you get if you become a user. Jonathan, how did you guys approach that?
And Eric, what we do in Claremont County, we do the WFI EZ at each 6-month period. So we wait for the 6-month period, just like you were saying, right between 3 and 9 months, and then each 6 months afterwards.
Sounds good. Sounds good.
Okay, thank you. So regarding the tablet, here's a question. How do you resolve the problem of wireless access in the field, and is the technology HIPAA compliant?
It is HIPAA compliant, and the wireless access is in the field. We use the offline version with our, we use Adobe. We use open source technology, but we have put the forms in as an offline access where we do not transmit that data to actually RepTrack until we're back into a Wi-Fi accessible area. So for a limited period of time, and very limited period of time, that information is stored on the tablet. Now it has no individual information whatsoever on it. However, the second it is back in the office, then it is synced back through Wi-Fi, through the system, and that information is transmitted.
And are reminders built into the system to keep people on track with their administration?
I have developed a system that actually generates the reminders every week, every Monday morning, and they go out to the particular participants. However, WrapTrack, as you can speak on this as well, either April or Eric, you also have that with the TMS where you can actually build in the reminders as well. Is that correct?
Yeah, TMS, WrapTrack has an email function that
Correct.
you can use. And just so folks know, the technology that Jonathan is talking about, we are actually in the process of transferring that ability over to UW so that anyone who uses the WFI EZ will have access to that, what we would call like an application or software as well.
Okay, and I think this is a very related question. Could the WFI EZ be incorporated into our electronic health record rather than incorporating another system?
This is April again, and we have been dealing with this question a little bit. There are some IP issues there, intellectual property issues there, that the folks, legal folks at UW would have to work around in order to make that happen. It's not impossible, but it takes a little bit of a workaround.
Yeah, the technology is not the barrier. That's something that can be programmed. It probably would take a little bit of investment in programming time, which we have folks who are available to do that with your EHR. The other thing worth mentioning is that we do have a electronic behavioral health information system. You've heard reference just in the last couple minutes to something called TMS, which is the team monitoring system. There is a wraparound configuration of that comprehensive electronic health record system that does link directly to the WrapTrack system for collecting the fidelity data. So there's a couple ways in which that could be achieved for a community or a site or a managed care organization.
Okay, I think we're able to see the results of the poll now. If Eric, I don't know if you want to debrief a little on that.
Well, I do think that, again, people are being honest. They're not sure yet. They only got 15, 16 minutes of exposure to the concepts, and we invite you to, so 30% of folks say they don't know. But among those who hadn't had a sense or an opinion based on what they saw, it looks like a good 3/4 of those folks who had an opinion said that they thought that it would be a useful thing for their site to participate in. This kind of an external review that rolls up all those different pieces of data into something comprehensive. So that's encouraging. I'm not surprised that 1/3 of folks aren't sure yet. They have to kick the tires and get more information. But again, you can get access to summary information about WrapSTAR by going to our website. Again, you can go to wrapinfo.org and click on the Wraparound Evaluation and Research Team. Or you can send us an email if you'd like to kind of see some more materials that spell it out. And that email, remind me if I'm wrong, I think is wrapinfo@uw.edu, correct, April?
Nope. No, the website is, the email is wrapeval, WRAPEVAL, @uw.edu. And the website's wrapinfo.
Right, the website's wrapinfo.org, and the email is wrapeval@uw.edu.
Okay, so I have a couple questions here related going back to the, I guess this is WFI EZ because they're in the early part of the list here. They're kind of related. So one says, is there a reason family support partner feedback was not included in the WFI EZ? And somewhat related, when are you going to add a question or measure to assess the degree of parent and youth support person involvement? So whether there's family partners and youth partners.
Wow, it's just two great questions. So the first question is really a measurement question, and I had to kind of speed through a lot of data and skipped a little bit. One of the things that we do have prepared are the types of responses from family partners on the WFI EZ, and we do have over 100 family partner WFI EZs collected using the team member form of the WFI EZ. So remember, there's 4 forms of the tool. facilitators, caregivers, youth, and team members. And the items are all parallel. They just change the wording, and so it's very appropriate for family partners to use the team member form of the WFI EZ as a way of getting their information out there. And they have the ability to click what role they play on the team, which means that when you're looking at your data, you can ask, what do family partners or youth partners, for that matter, what's their opinion about the type of quality and adherence to wraparound principles is going on for this family that they're working with. And although I kind of whizzed past it there, Spencer Hensley from our team has been compiling the data from the EZ and found some very interesting things, which basically were that family partners, although they're often working in sync with facilitators, their responses to different items were anywhere from 8 to 12 points lower than facilitators talking about the same family's experience. So it could very well be that one way to get more objective, or at least more critical view of implementation on the ground level, is by asking family partners to get about their opinion of what they've seen. So great question. It's totally doable, and we're already getting good information from family partners. Your second question is a little tougher to answer because it's not just a measurement question. It's kind of a conceptual practice question. What we tend to do here when we're developing these accountability tools is make sure we're following the lead of the field in terms of the types of consensus that what consensus there is about practice, or what research there is about practice, and following that in terms of measuring what research or expert opinion says is what should take place. And you know, for literally at least 6, 7, 8 years, more than that perhaps, of our efforts to put together these kinds of fidelity and quality tools, people have been asking, well, what about specific tools that are specific to the family or youth peer support partner role, and whether it's being done with fidelity to a model? And I think the short answer, and Janet can chime in because she's done quite a bit of work around youth and family peer support, is that the consensus has been more difficult to kind of get around the nature of the work. We have at the NWI developed a number of guidance documents about the role of parent and youth peer support in wraparound. But the fact of the matter is that it's been a lagging kind of endeavor to translate what has been produced in terms of specifications for those types of team members into fidelity tools. Janet, you have anything to kind of add to that?
Just that it's certainly an area that we are working on, particularly within NWIC and here at Pathways, particularly with relevance to the youth peer support role. So it's, I would say, Erica pretty much characterized where we are quite accurately, actually.
Yeah, and that having been said, there is a peer and youth, or a family or a parent and a youth peer support curriculum within the National Wraparound Initiative, the National Wraparound Implementation Center's training and coaching path, but we have not yet translated it into these external fidelity measurement tools. But it's something we are actively working on.
Okay, I want to skip real quickly to a couple of WrapSTAR questions, and I think we're going to have to, sign off shortly. So I think there's some folks that want to know, how do they get involved with local efforts to use WrapSTAR, and has it been used in California at all, and any information about cost?
Jennifer, you want to try to take that on, or should I start?
I can start. It has only been used locally here in Washington. That's where we have done our piloting, but it is expanding to other Midwestern and Southern states. It has not been used in California. Right now we are basically just seeing if it can go to scale and how that works for our team in terms of our resources, but that's one of the reasons why we're really focusing on partnering with other entities like a Center of Excellence that might already serve as kind of an external oversight or support body within a state or within a local initiative. So if you're a local initiative that is interested in learning more about how you might be able to get involved, how you might be able to get trained in WrapSTAR, definitely send me an email. My email is jscold, like the temperature, jscold@uw.edu, and we can start some of those conversations. In terms of cost, again, it really just depends on what your site looks like, what level of involvement you would want us to have versus what level of involvement or effort somebody at your local level could take on. It could be like a training model. It could be something that we as the University of Washington come in and do and are contracted to do with you. So there's several different ways that it could be set up depending on your local situation. But the first step is to reach out to us and start the conversation. Does that answer all the questions?
I think it does. Okay. I think at least one or two of these questions were answered during the presentation.
I can reiterate. But
well, I mean, they wanted to know what does it take to get going with WrapSTAR, and I think you did a really good job of covering all of the kind of commitments, the data gathering, and what it looked like from the community level. So I would encourage that person to check back.
To get started is to really, send us an email, give us a call, and we can start a conversation. It's not something that is at the point that it's ready to just be handed off. It's not like the WFI EZ or the TOM where you can license it as a protocol or as a process. At this point in its development, it really does require our involvement still.
Okay, and again, people, if you have any questions about the measures, including WrapSTAR, I know that Jennifer gave her email, but you can do rapeval@uw.edu, and I've put that into the questions pane several times now, so people can see that. I think maybe, okay, last website about RapInfo, we have that. Any suggestions for communities that don't have resources to implement a full fidelity system? For example, is there a low-cost, low-overhead way to use the WFI EZ as a starting point? Or is that what you would suggest?
Yeah, I think that the WFI EZ is really kind of our go-to tool in terms of trying to make sure that the site has the ability to do a few things that are important. One is to get perspectives from families and youth as well as your practitioners about what their perceptions are about how wraparound implementation is going with families. So the fact that it does allow you to get those perspectives across those different informants, and the fact that it does get a few satisfaction and outcomes questions out there, it really does feel like kind of the easiest entree into using any of these standardized tools. And of course also there is this web-based system that allows you to at any point in time create reports that show how your site is doing across the different domains and items and how you're doing compared to these national norms, or means at least at this point. So it really is probably the lowest hanging fruit. And the fact of the matter is that we're always running in the red with this stuff because it's important in our mind to get things out there. I think there's at least there's over 100 sites, communities, and states out there that have used our tools over the last just in the last couple of years, or if not at any given time. And a lot of that's because we try to keep the prices really low, even though we have that fairly complex data system behind it. So again, encourage you to go take a look and see if it looks like it might be useful for you all. And the last point I would make about sites with low levels of resources is that we won't let anybody who doesn't have the $1,200 to license the tool for a year not have access to it just because of lack of resources. So all you have to do is just ask for a waiver of fees or a reduction, and we'll always be responsive.
Okay, so finally I'm wondering, Jonathan, if you're still there, can you give me your email if you're willing to have people contact you further about questions about the tablet?
Absolutely. It is Jonathan, Jonathan, _ Sutter, Sutter, at isoc.net.
And all of these emails are on the last slide of the presentation.
Okay, and
put that up there.
And just to remind you, the presentation will be available shortly on the website, easy to find from the NWI. Just put in NWI Wraparound and you will get it. And I think with that, we are pretty much done. And I just want to thank all of our presenters for a really information-filled webinar, and thanks for everyone who joined us out there in the world. Okay,
yeah,
goodbye
thank
everyone.
You. It was a pleasure. Take care, everyone.
Thank you much.
Thanks,